Did you know that heart disease is the leading killer of Americans? Well, a new survey found that only slightly more than half of adults know this fact. An even larger number do not fully understand one of the most common methods for treating the most prevalent form of heart disease, coronary artery disease, or CAD, which can lead to heart attacks. Here now with more on this survey and to set the record straight about heart disease and treatment options for CAD is Dr. Alpesh Shah, an interventional cardiologist with Houston Methodist Hospital. Doctor, thanks for joining us today.
Well, thank you for having me.
Doctor, what are some of the key findings of this survey of adults' basic knowledge about heart disease?
Well, recently there was a poll conducted, Harris poll, and that actually taught us very interesting facts. So, for example, it is good to know that there is increasing awareness amongst folks about how to prevent heart disease. There's also a good amount of awareness where it comes to detecting heart disease and what sort of testing ought to be done. But what really surprised me was the very fact that folks still do not know what are the treatment choices, what are the options, what if somebody already has heart disease, and what can be offered to help treat those arteries.
And what are some of the things we need to know about keeping our heart healthy? What is coronary artery disease, or CAD, and why does it need to be treated?
Look, heart healthy means we got to know our risk factors. We got to understand what are the risks of getting heart disease, especially prematurely. We got to live our life heart healthy, whether it is with more exercise, better diet, weight loss, because all of this contributes to coronary artery disease. Coronary artery disease is one of the commonest form of heart disease. It affects 15 million adult Americans. Coronary artery disease is what causes heart attacks. So it's very important that we understand what causes those blockages, how do we prevent it, how do we detect it, and if the need be, fix it on time.
Can you tell us about some of the treatment options that are commonly used for CAD?
So the treatment options continue to improve every day. Remember, as we talked, there is going to be some personal responsibility. We will have to focus on diet, exercise, and weight loss. Smoking cessation is very important. When we talk to our physicians, they will tell us about what else needs to be done, whether it is correcting diabetes with medications or blood pressure or cholesterol medications. Everything helps here. But what has really changed and improved a lot are how do we fix heart disease once it is already developed and once it has already become very significant. Bypass surgery is one of the options, but over the last several years, stent technology has come to the forefront. Stents are metallic mesh which can be inserted through the arteries, which allows us to really open up those blockages and restore the blood flow.
Now, the results of this survey found that Americans know little about stents. Could you elaborate on exactly how they work and if there are different types of stents we should be aware of?
Sure, I'll be glad to. So stents are a metallic mesh tubes. As I said, they are inserted through one of the groin arteries or the wrist arteries, and over a wire and on a balloon, we actually bring it to where the blockage is in the heart. We expand it open, and that allows for restoration of blood flow and the oxygen to the heart muscles. That will obviously alleviate a lot of the symptoms of chest pain or breathing difficulties, and in a lot of cases actually prevent or stop a heart attack. Stent technology has advanced a lot. So from the days where some of the stents would re-narrow, we came up with drug-coated stents, which really has allowed us to not have that problem. However, there is a new stent called Synergy. This has really revolutionized how we are able to approach and treat those coronary arteries and the blockages. Synergy is very unique. The engineers have done a remarkable job at creating this design of a very ultra-thin, form-fitted stent which can be delivered to any part of the human coronary arteries. It is coated with a drug, so it does not have any restenosis or re-narrowing of that blood vessel. But equally importantly, it is a bioabsorbable polymer. What that one particular fundamental fact helps is prevents any further recurrence of heart disease down the road. So it really allows for that blood vessel to heal long term.
Doctor, this has been great information. If our viewers wanted to get more information about this condition, where could they go to find out exactly what they need to know about CAD treatments?
Well, certainly I encourage all our folks to reach out to their physicians, understand their risk factors, and get themselves evaluated for presence of heart disease such as coronary artery disease. But beyond that, I think there is a website by Boston Scientific. That's a company which makes a Synergy stent. That's the one I'm partnering today with. It is called bostonscientific.com /Synergy patient. That website can be very helpful in not only knowing what we all talked about today, but also enhancing our knowledge as to the treatment choices and options, such as the Synergy stent.
Thanks so much for joining us today. We really appreciate your time in discussing this important topic.
It's been my pleasure. Thank you for having me.